This segment is sponsored by Dr. Portia Bell.
I can probably guarantee at some point during the day you're going to smile. So let's talk about your teeth. They're an important part of overall health. So Dr. Portia Bell wants to help you get as healthy a mouth as possible. And today we're talking about gum disease. Welcome, doctor. How are you?
I'm well, thank you.
So describe exactly what is gum disease, kind of the overall, when you get diagnosed with it, what's happening?
Gum disease is the infection of the bone that houses the roots of our teeth. Oh. The bone and the gum that overlies it.
Okay.
Yeah.
And what are some of the signs that occur when someone may have gum disease?
A person may see bleeding when they brush or floss.
Okay.
Some swelling in the tissue and redness.
Now, how much, I mean, not to get too graphic, but how much blood? Is it a lot of blood? Is it a little bit? Is it something that happens on a daily basis?
It's enough blood that you would notice. It
Okay.
doesn't have to be gushing, running blood.
Yeah.
It's any tinge of blood.
Got it.
That tissue should have good integrity, like every other part of our body.
Yeah.
We can wash our hands and our hands don't bleed.
Okay.
We can even clean out our nostrils with a tissue and our nose won't bleed.
Oh, that's really good.
Because as delicate as that tissue is, it does have good integrity.
Got it.
And so our gum tissue should have that same firmness and resistance to manipulation.
Now, I have heard that is bad breath also a sign of gum disease?
Yes,
Okay.
and we're talking about the kind of breath that is not associated with food odors.
Okay.
Obviously, some foods give us some odor or a morning odor.
Yeah.
I'm talking about the type of odor that travels, that
you can smell from a distance.
smell from a distance.
Yeah.
Yeah. It's a fetid, putrid kind of odor of a breakdown and the death of the tissue, actually.
So when people find out that they have it, what's done? Is it treatable?
Yes, it is treatable
that's
now.
Good,
there was a day when we just kind of watched and waited until a person's teeth got loose and came out and we put them in a denture. But now we can fight back.
Oh, that's good.
Yeah.
So how do they fight back against it?
There are treatments in general dental offices, including scaling and root planing. You might have heard the term deep cleaning.
Yes.
That is a term for cleaning on that root where the bone has been removed, removing all the toxins, bacteria, and the tartar that clings to the root.
Got it.
Those are the representations of the infection of the disease that's there.
So look for the signs. You said bad breath, the bleeding, and if you do have it or know someone that does, you mentioned dental offices. Where specifically should people go and can they go to get it treated?
Many general dental practices will treat gum disease. However, there are specialists in dentistry that do that very thing. They're called periodontists.
Periodontists. I like that word.
Yes, around the tooth.
Oh, that makes sense because that's where it's occurring.
Yes.
Wow, and I know your practice is so focused on the family. Remind our viewers where you're located and how they can reach you and the importance of covering everyone from young to old of age.
Absolutely. My office is located at Sunbury and Cassidy Roads in Northeast Columbus. We're just south of Easton Town Center on Sunbury Road. Our address is 2710 Crossroads Plaza Drive.
Great.
And that's in 43219.
Perfect. And at what age do you start taking people? How young can they be when they see you?
Well, we actually do lap visits with infants starting at age 9 months.
Wow.
We want to make certain that the child is developing well and give the parents instruction as to how they should clean their little one's teeth. So I always like to say from birth to death, or as someone said, from the womb to the tomb.
There you go, the entire life.
The lifespan of the individual.
That is great. Well, this has been important information that everyone needs to know about. Dr. Portia Bell, we greatly appreciate you coming in.
Thank you so much for having me in today.
For the best in oral care, make sure you check in with Dr. Portia Bell. Set up an appointment today. Just call the number 614-212-4116.